Dear students, we will continue with Schistosomiosis, and today we will discuss the part 3. Outlines. We will discuss Schistosomiasis, uh, its epidemiology. We will start today with the epidemiology, pathogenesis, treatment and preventions, etc. Lecture outcomes. So by watching and listening to this lecture, student will be able to talk about schistosomiasis in detail. So let's begin with the epidemiology of schistosomiasis. Now, human waste in water containing intermediate host is the single most important epidemiological factor in schistosomiasis. It means that if uh, humans are disposing their fecal material, their stool, into the water, and if in that water the intermediate host, the species of snail which is acting as intermediate host for schistosomiasis or for the schistosoma, if they are also present in that water, then it is like dangerous. It will lead into the spread of schistosomiasis in that area. And the next very important thing is the presence of or the availability of the suitable snail species, which will actually determine the epidemicity of a particular species of schistosoma. As we discussed in detail in the previous lectures, that snail species and the schistosoma species, they are very specific to each other. They are species specific. For example, there is a specific intermediate host, snail intermediate host to Schistosoma hematobium, and there is a specific snail host for Schistosoma mansoni, and there is a very specific host of snail for Schistosoma japonicum. If the host and the snail host and the schistosoma host, if they are not compatible, so there will be no schistosomiasis. So schistosomiasis cannot develop. The epidemiology is zero in that area if they are not available. But if the people are discarding or disposing their waste into the water, and in that water the specific host, the suitable host, the intermediate host, the snail is present, then schistosomiasis will be at its peak and the schistosoma will develop there, and this area is at danger of epidemics of schistosomiasis. So now this is the fact that the suitable intermediate host is very important. Let me give you an example. Like I will show you on the map in the next slide. But here I will tell you that both Schistosoma mansoni and Schistosoma hematobium, they are widespread in Africa. They are like present in throughout the Africa. But only Schistosoma mansoni was established in the New World, in the Americas, in the North and South America. It only established there. Now, both, hear me out very closely. Both Schistosoma mansoni and hematobium, they are widespread in Africa. But only Schistosoma mansoni established in New World, in the Americas. Why? Because in the New World, in the America, the suitable snail host for Schistosoma hematobium is not available. That's why it did not spread there. But for the Schistosoma mansoni, the specific snail host is available there. That's why this Schistosoma mansoni species, it spread all over in most areas of the South America or in the America. And how it happens? Because of the slave trades. You know that in the world many slaves are like transported from the Africa into different areas of the world, because Africa is a very poor and underdeveloped country, and people mostly like have slaves, or they buy slaves from there. So because of the slave trade, this schistosomiasis the Schistosoma mansoni and the Schistosoma hematubium, they were like dispersed to America, but because of the unavailability of the Schistosoma hematubium species specific snail, it did not develop there, and Schistosoma mansoni, it is now widespread in America. So survival of these parasite also depends on human habits of polluting water with their own feces. If they do not like dispose their waste um, or their stool directly into the water where the intermediate host is also available, so the spread of this disease will stop. But if if the human are disposing and polluting water where the intermediate host is present with their infected feces, so the disease will spread out. So here you can see that this black areas in Africa, it shows the distribution of Schistosoma hematubium. So all these black areas in this the Madagascar island, in the and almost in the central, in the western, in the southern Africa, you can see all over the Africa this Schistosoma hematubium is widespread. Also, the Schistosoma japonicum is also like present here in these different areas of China and in the Malayan Islands, and also the Schistosoma mekongi is also widespread in this old world. Now, if you look at the map of the New World in America, especially in the South America, so you will see only the distribution of this Schistosoma mansoni. Why? Because of the presence of like its intermediate host. And why Schistosoma hematubium is not widespread over there? Because of the absence of its intermediate hosts. Now, look, the hygienic waste disposal is sufficient to eliminate schistosomiasis as a disease of human. How you can hygienically dispose by using a pit latrine system. This is a pit latrine system where there is a small hole in which like you can drop the human waste. You can dispose the human waste through this small hole. It's just like the normal latrines or the flush system at our homes. So where there is a large room inside the earth, it has and there is a small hole through which human excreta are disposed into this large room. So it's a very safe way of disposing the waste, and it will help. This only adopted by only adopting this method, we can like eliminate schistosomiasis at all. But the tradition, it wants the salvation and the ban of cultures prompts people to use the local waterways for sewage disposal instead of foul spilling outhouses. So the people they actually use the local waterways and the sewage disposal instead of this outhouses. And this is what like activates the distribution of schistosomiasis. Like a bridge across a small stream become a convenient toilet for the whole village, and a grew of a mango tree or a rivulet, mean a small stream or a small river, is a haven for children, and where they bombard the area with their feces. So like disposing the fecal material like through this way into the stream or to the small rivers or to the other waterways where the intermediate hosts are available. So it will only increase the chances of like this distribution and epidemics of schistosomiasis. But by adopting hygienic ways of disposing the fecal material, like I told you, the use of pet latrines, we can like easily eliminate this disease, the schistosomiasis. People there are more vulnerable to the schistosoma infection are especially farmers who wet their irrigation water, wade in their irrigation water, fishermen who wade in their lake and streams, children who play in any contaminated body of water, and people who wash clothes in streams. So in case of all these, if the farmers are like using the irrigation water which is like polluted, so they may get the infection because they walk barefooted in that irrigation water. And just like the fishermen, they like get into the water for fishing. Children's they play, especially in summers, they play in water, in the contaminated water. And people who are like washing clothes in streams, they are more vulnerable to the infection. Now, focus of infection in Brazil was a series of ditches in which watercress was grown for food. So, and those ditches, they were like very good places for the development of different stages of schistosomiasis. Now, in Muslim countries, there is a religious requirement. We all do ablution. अगर आप में से किसी को नहीं पता कि एब्लूशन क्या है तो उसका मतलब है वजू करना. But it's a very important requirement for Muslims. So where they wash their anal and urethral orifices after urination and defecation. So जिसको हम कहते हैं istinja. So istinja is very important. We do that after like defecation and urination, and then we like clean for more cleanliness. Then we wash our hands and face and foot, etc., etc. So this is an act intended to achieve greater cleanliness as an important factor in the transmission. So this is also very important in the transmission if it is not carried out in a hygienic way. So not only a convenient water source is used to perform ablution, likely to be contaminated. Maybe it's most of the people, they try to use a very convenient waterways for performing their ablution. So they use the river water or in the canal water, and if that is contaminated, so this is very dangerous. And it's not like only dangerous for them that they will get the infection from that water, but more likely maybe the human beings, the human being who is using this water for ablution, maybe the person is contaminated by himself, and maybe he will contaminate by that water, will contaminate that water source by like depositing or defecation or urination. So in both way, the person may get contamination, infection from the contaminated water, or he may contaminate the water. So like economic condition and education level of our population will also influence the transmission of disease, and age and sex are also important factor as well. Like males usually show the highest rate of infection and most intense infections, and the most hazardous age is the second decade of life, mean after 10 years. The distribution of the disease appear to reflect occupational and recreational differences rather than sex or age resistance to infection. So, like male, why male have like a high rate of infection? It is because of their occupational and their activities. In Suriname, where both sexes work in fields, the highest prevalence occur in adults of both sexes. Certain other factors such as immunity and cessation mean ceasing, stopping of egg release, and chronic infections. You know, in chronic cases, the schistosomiasis become chronic, so they will like the patient stop releasing egg. Must be considered when a population is surveyed and transmission is studied. So you must like keep in mind these chronic conditions and also the immunity. So this the building up of granulation tissue in the gut or the bladder wall prevents release of eggs into feces or urine, and will mask infection in the absence of immunodiagnostic or biopsy method. So as I told you in the previous slide, in chronic cases, like it will stop releasing eggs because of this granuloma tissue formation. So you should keep in mind, if you don't have proper immunodiagnostic or biopsy methods, so you will like be misguided, and you will place a person in non-infected people, but actually he will be infected, and the infection is actually masked. Further, even though infected person may be gravely disabled, they are removed from the cycle of transmission. So during the course of infection, some protective immunity to superinfection is elicited, but either by repeating exposure to the cercaria or by the presence of adult worms. Although the adult worms themselves are not affected by the immune responses, as an example of concomitant immunity. And resistance to infection in is most apparent in adults, and children are least resistant. Now, resistance become apparent during the period of 8 to 18 years of age. It is unclear whether the resistance is due to a slowly acquired immunity during the course of repeated exposure through childhood, or to some other age-related factor such as sexual maturation. It is of utmost importance to recognize that by extending snail habitat, agriculture projects intended to increase food production in underdeveloped countries have in many cases created more misery than they have alleviated. So like in those area where people they will like start different projects for the development of agriculture and for the increased food production in underdeveloped countries. So they may think that we are doing good, but it may like lead into misery of the schistosomiasis, because for agriculture and for food production we need water reservoirs, and that water reservoirs, if not properly managed, may lead to the elevation of this disease, the elevated number of schistosomiasis disease. For example, $10 million irrigation project in southern Zimbabwe had to be abandoned 10 years after it was started because of schistosomiasis. So the 10 billion irrigation project was launched in Zimbabwe, but it was then abandoned. It was stopped 10 years later because it caused schistosomiasis to goes very up to very elevated level, and it caused problems, so that was stopped. Another example is that of the Aswan High Dam in Egypt. This dam had much benefits for the Egypt, but it was cancelled because of the increased and the disease or the misery it caused. Restraint of the wide fluctuation and the water level of the Nile, although making possible 4 crops per year by perennial irrigation, has also created condition vastly more congenial to snails. But like before the dam construction, this perennial irrigation was already practiced in the Nile Delta region, and the prevalence of schistosomiasis was about 60% in the 500 mile of river valley between Cario and Aswan, uh, where the river was subject to annual floods. Prevalence was only about 5%. 4 years after the dam was completed, the prevalence of Schistosoma hematobium ranged from 19 to 75%, with an average of 35% between Cario and Aswan, or in an average 7-fold increase. So now, before the construction of this dam, it was like 60% around in the area between the Cairo and Aswan, or it was like prevalence was about 5%, you can say. But when this dam was constructed, so after this 4 year after its construction, the Schistosoma hematobium, it ranged from 19 to 75%, and with average of 35 between Cario and Aswan. So this average was like 7-fold increase, and that's why like this project has to stop or to cancel. So in the area above the dam, prevalence was very low before its construction. In 1972, 76% of the fishermen examined in the impounded area and were infected. But later on, in 1982, study showed a continued increase and prevalence in 6 villages of Upper Egypt. So, damming the Yangtze River in China will create the enormous Three Gorges Reservoir and substantially change ecosystem in the entire area. Widespread increase in the prevalence of Schistosoma japonicum is likely. So the role of reservoir host and strains of parasites have some importance as epidemiological factor depending on the species. Member of no fewer than 7 mammalian orders have successfully been infected experimentally with the Schistosoma mansoni. However, certain monkeys and a variety of rodents are probably important natural reservoir host in Africa and tropical America. So, these certain monkeys and certain varieties of rodents, they are very important. They are natural reservoir hosts in America, tropical America and Africa. Schistosoma hematobium is more host specific than is Schistosoma mansoni, and it is thought that no natural reservoir host exists for Schistosoma hematobium, and it is more host specific. The opposite is true of Schistosoma japonicum, which seem to be the least host specific, and it can grow in many hosts, and that's why it is widespread even in tropical America. So it can develop in dogs, cats, horses, swine, cattle, caribou, rodents, and deers. But there seems to be more than one race of the swarm, and susceptibility of a given host varies. For example, S. japonicum is widely prevalent in rats in Taiwan, but it is rare in humans there. So maybe host susceptibility is it matters. I mean, the rats are more susceptible to the infection with the Schistosoma japonicum as compared to the humans. That's why rats are like more infected. There are the more recent description of Schistosoma mekongi and Schistosoma malayensis is distinct from Schistosoma japonicum suggests that the traditional Schistosoma japonicum may be a complex of cryptic species, and I think you know what are cryptic species. Those species whose diagnostic features are not clear are known as. So, next we will discuss pathogenesis. It is very unusual or strange about this infection that here the pathogenesis is does not caused by the adult worm itself, but actually it's the eggs of this worm which cause the pathogenicity entirely. So it was mentioned and we discussed it in the previous slides that the eggs actually transverse or cross through the gut or the bladder wall, which is surrounded by granuloma. I will show you in the I already showed you, but I will show you in the next slide again, which disperse or broken down or break down upon reaching to the lumen. Now clearly the granulomas do not disperse from the eggs. They do not reach the lumen. So once they reach the lumen, they break down, remaining in place and leaking antigen for a considerable length of time. Now thus the primary lesion in schistosomiasis is a delayed type hypersensitivity reaction around the. So here you can see the egg of Schistosoma mansoni and a granuloma. This is the G is the granuloma, and E is the egg, and I is the leukocyte infiltration in the site where the egg has been granulomized. And this you can see the Schistosoma mansoni and a granuloma, the internal wall, and the eosinophils, the egg E is the egg, and this M is the mucosa. So, however, progress and outcome of the disease are a result of a complex interplay of immunopathology involving both the Th1 and Th2 arms of the immune response. Schistosomiasis is often divided into three phases: the migratory, acute, and chronic. So the migratory phase encompasses the time from penetration until maturity and egg production. It is often symptomless. Uh, the Cercaria finds its way through the skin and penetrate, and then it reaches to a destination, and there they start egg production. So till date, the migratory phase, or till date, there is no problem. So penetration of Cercaria may produce a dermatitis if a patient's immune system has been sensitized by earlier experience of cercarial penetration. So this is one condition. Schistosome dermatitis is usually most severe when caused by bird schistosomes. We will discuss this in later slides, or maybe in the next lecture we will discuss this schistosomal dermatitis, or it is known as swimmer itch, or it is also known as digger itch. So we will discuss it later. So in migratory phase there is no problem, but sometime if the person is sensitized already, or if the wrong schistosoma species enter into the human, it may cause some problems like itching of the skin. Otherwise there are no certain problems, or like there is no problem in this phase. Probably because of the Cercaria, probably because Cercaria are. So the acute phase is sometime it is called Katayama fever. Why? Because this problem was very common in an endemic area at Japan, and that the name of that area is Katayama, and that's why this fever was like famous with the name of Katayama fever. And this phase, or this acute phase, or the Katayama fever, it occurs when the schistosomes start producing eggs about 4 to 10 weeks after initial infection. So and these 4 to 10 weeks from the penetration up to the production of the eggs, it will take 4 to 10 weeks. So after 10 or 4 weeks after the initial infection, this phase will start, the acute phase will start. By this time, a host has had considerable exposure to various schistosome antigens sufficient to mount a humoral response. But the advent of egg production substantially increased the amount of antigen release. The change in the antigen-antibody ratio lead to formation of large immune complexes that must be cleared by cells of the reticuloendothelial system, RES. The syndrome is marked by chills and fever, fatigue, headache, malaise, muscle aches, lymphadenopathy, and gastrointestinal discomfort. So what will happen? These will be the symptoms of the disease. So you may like umbrella this line under the symptoms. Because of the elicitation of the different immune responses, the patient will like feel chills and fevers, fatigue, headache, malaise mean जिसको हम कहते हैं ना कि कोई आप जनरली कैसे अनकंफर्टेबल फील कर रहे होते हैं. Muscle aches, lymphadenopathy mean the swelling of the lymphatics, and gastrointestinal discomfort. There is a high eosinophilia, mean eosinophils will increase in number, it will shoot from the normal, and granuloma will form around eggs, contain a large number of eosinophils. As I showed you in the picture, the egg will be like surrounded by a large number of, or by the infiltration of the eosinophils, as well as neutrophils and macrophages will also there. So it's like common for a granuloma. In granuloma normally we find these important cell macrophages, neutrophils, and eosinophils. Macrophages is an early acute granuloma secrete predominantly IL-1, and then TNF increases after 1 to 2 weeks. So these factors, these immunologic factor will increases after 1 to 2 weeks of infection of the granuloma formation. So chronic granulomas are dominated by macrophages, lymphocyte, fibroblast, and multinucleated giant cells. So sometimes, like in chronic, especially in chronic cases, the eggs are actually completely surrounded by different immune cells, very important immune cells, the fibroblast, multinucleated giant cells, macrophages, and the lymphocytes, and it becomes the chronic case. Uh, these become small fibrous granulomas or pseudo-tubercles, so called because of their resemblance to the localized nodules of tissue reaction tubercles, just like in tuberculosis, TB. So just like the tubercles of the TB, these are known as, because of the small fibrous granulomas, they are known as pseudo-tubercles. They are not exactly like the tubercles of the tuberculosis, but they are like they are known as, they are called as pseudotubercles. So this is the egg, and these are the areas where the eosinophil will infiltrate, and the neutrophils and the macrophages, and will make a granuloma. So many eggs are carried by the hepatic portal circulation back up into the liver, where they stimulate granuloma formation, and some may be carried to the lungs or other tissues. In chronic phases, those patients who are like indigenous to the endemic areas, they are commonly asymptomatic. They will show, they will not show many symptoms, or maybe they are, or those patients with the intestinal schistosomiasis, they may show some mild chronic symptoms like bloody diarrhea with mild abdominal pain and lethargy. So with schistosomiasis or hematopia, there may be pain on urination and blood in the urine, which give it the name hematuria or bloody urine. So affected people usually accept these conditions as normal and only seek medical assistance with the heavy infection or when more serious complication develop. So normally affected people will accept these normal conditions, but if there is severe conditions or heavy infection, then they seek or they go for search for medical assistance. Otherwise they treat these as normal condition. In most cases, the patient's immune response are modulated so that the granulomatous reaction do not become too severe. For example, although macrophages will secrete fibroblast growth factor, which will mediate or like support fibrosis, but they also secrete collagenase enzyme that will digest that collagen fiber, and this is blessing. Otherwise, granuloma will form, which will be very dangerous for the liver. So a balance between collagen synthesis and degradation in most cases prevents progression to serious hepatic fibrosis. So this is very good and it is helpful. And about 8% of cases of infection with Schistosoma japonicum and Schistosoma mansoni development of eggs, granulomas and fibrosis in the liver seriously block portal blood flow. But it's a blessing because of this antagonistic function. In only 8% cases the granulomas will develop. As the eggs accumulate and the fibrotic reaction in the liver continue, periportal cirrhosis and portal hypertension develop. So a marked enlargement of the spleen, which is known as splenomegaly, occurs partially because of the egg lodged, means stopped, blocked in it, and partially because of the chronic passive congestion of the liver. So ascites mean accumulation of the fluid in the abdominal cavity is common at this stage. Here in this picture you can see two boys. This one is 13-year-old and this one is 24-year-old. So you can see it also an example of dwarfism caused by Schistosoma japonicum. So this is 24-year-old and this one young one is 24-year-olds and this one is 13-year-old. Some eggs pass the liver, lodging in the lungs, nerve system, or other organs and produce pseudotubercles there. Pathological changes due to Schistosoma japonicum tend to involve the small intestine more extensively than other due to Schistosoma mansoni. Frequently, fibrous nodules containing nests of eggs occur on the serosal and peritoneal surfaces. Now, eggs of Schistosoma japonicum reach the brain more often do those of the other species. Schistosoma japonicum eggs are more dangerous as compared to the other species, and they reach more often to the brain. 60% of all neurological diseases and schistosomiasis and almost all brain lesions are due to Schistosoma japonicum. So it's more pathogenic as compared to the other species. Because adults of Schistosoma hematubium live in the venules of the urinary bladder, the chief symptoms involved in this case are associated with the urinary system. Onset of the or start of the bloody urine hematuria is usually gradual and become marked as the disease develops and the bladder will become more ulcerated. Change in the bladder wall, as you can see in this picture, are associated with the DTH reaction around the eggs, that is pseudotubercles, fibrous infiltration, thickening of the muscularis layer, and ulceration. And chronic heavy infection lead to genital, urethral, and kidney involvement and to lesions in other parts of the body as with other species. Oh, you can see here the eggs. You can see these lesions or the tubercles. You can see the ulceration here, or you can see the metaplasia in different areas. Major disease manifestation and chronic schistosoma hematubium infections are urinary tract blockages. So in most chronic cases, the blockages of the urinary tract may occur. Chronic urinary bacterial infection may occur, or bladder cancer. It may lead to bladder cancer, the prolonged or chronic infection with Schistosoma hematubium, and bladder calcification is also a condition which may occur in the chronic schistosomiasis. Invasion of the female reproductive tract is most common with the Schistosoma hematubium, but it can also happen in Mansoni and Japonicum and intercalatum infection. But it's more frequent, or mostly it occurs with this hematubium. So intricate vascular links between the rectal and the bladder venous fluxes provide easy access of migrating worms to internal and external female genitalia, and up to 75% of women infected with the Schistosoma hematubium have eggs in their genitals. We will continue this lecture. Thank you so much for watching and listening. These are the references. Uh, Thanks so much. See you in the next lecture.